Do you feel your periods are like torture? Do you have severe pain and you're scared of the next menses? And do you also think that's normal? It could be something called endometriosis. Today, we'll discuss everything about the diagnosis and the treatment of endometriosis, including its symptoms. So, what is endometriosis? Endometriosis is a condition where the inner lining of the uterus may be present outside the uterus. It could be in the ovaries, it could be outside in the uterus, it could be on the pelvic wall, or it could be elsewhere as well. It can engulf the ureters, the bladder, the bowel, or far off places like liver, lungs, and even the nose is known to have endometriotic cells. Now, what is this endometriosis? It is the lining, as I said, and there is no outlet to it. So there is bleeding, there is a deserialization which happens during a normal endometrial change, which is also happening within that part where there is endometriosis. So there is scarring which happens later on. So once the scar tissue happens, then there is severe pain in that area because the nerve endings are stimulated. So patients might have lower abdominal pain. They might have pain while they are passing motion. They could be having pain while passing urine, or it could be a severe backache. So which may be even radiating if it is engulfing the nerves or irritating the nerves. So it could present as wide presentations, including there could be some patients who are having severe cough during their periods, or they have a nasal bleed which may be every month. So, or they may pass blood in urine during their every cycle. So this could all indicate that they have endometriosis. So what do you do about it? So first of all, we need to diagnose. So you need to see a gynecologist who will examine you. Okay, first of all, the person will get to have an idea once you start telling your history, because once the history is told, the doctor makes a presumption, and on internal examination we get to know whether there is any involvement of the ovary or there is involvement of the uterus outside the uterus, or it could be in the rectum. A per rectal examination also helps. So this is followed by a sonography where it can be confirmed. Sometimes MRI also may be required in case it is a widespread disease and the doctor is thinking of operating on you. But a gold standard for diagnosis is always laparoscopy, because once you see the lesion, then can you do something about it, and also you can take tissue for testing as well. So that is about the endometriotic lesion and how it is diagnosed. Now coming to treatment, we could start with small painkillers, and there are intrauterine devices also which locally release progesterone. So it is basically a hyperestrogenic state. So high estrogen level causes growth of these lesions. So we have to give progestins or progesterone to counterbalance it. It could be in the form of tablets, or it could be in the form of intrauterine device, or it could be in the form of injections, or it could be in the form of oral antagonists. Now there are newer ones which have come. So those really help the patient in relieving pain temporarily. But if there is a florid disease, or if the disease has spread, then operative surgery also may be required. So that mental preparation is very important on the part of the patient. It should not happen that you keep suffering with the disease for a lifetime. This disease can also cause infertility, because infertility is a very common condition rising these days because of late marriages. Now unfortunately, with the early onset of period, that is early menarche, or shorter cycles, or patients or women who are delaying their pregnancies, they are unfortunately found to have more chances of endometriosis as compared to the others. Now, what are the theories? There are so many theories behind why it happens. It's because there could be retrograde, because from the uterus it can go inside the fallopian tubes and then land outside. So these are all theories. So there is, because of retrograde menstruation, or because of the sperm also may carry it, is what is said. Or it could be a genetic problem and there is a change in the endometrial cells. Or it could be because of plastics work like estrogen. So these conditions found to be higher. There are certain hormones, because it is estrogen sensitive. So high estrogen receptors, which are again genetic, they are more prone for endometriosis. And so these are the predisposing factors which can lead to endometriosis, but you can't really control many of them. So what you need to do is find a right diagnosis and get it treated in time. So endometriosis is not the final verdict, and you need not suffer from it all the time. You should always take help, and you should be in a position to take the next step when the doctor tells you. So it could be with medicines, or it could be even surgical, but don't hesitate. Thank you.